In this video, we'll be reviewing osteoarthritis. We'll be doing that by going over 5 questions. I will read the question to you for those listening to the video, then pause, give you a chance to think for a second, show you the answers, and then we'll discuss which one is best. There'll also be some questions on joint replacement, which is one of the treatments on osteoarthritis, so you'll see that here as well. If you want more information on the subject, it's usually in your musculoskeletal chapters of your nursing resources. And if you look at the picture real quick, you can see that that healthy knee joint on the left, it's got like that middle pillow, which is the cartilage, and on the right, that has disappeared at this point, and that would be osteoarthritis, is just by definition the degeneration of the cartilage. So let's get started. Question number 1. In taking the health history of a client with severe painful osteoarthritis, the nurse would expect the client to report which of the following? Is it number 1, the gradual onset of the disease with involvement of weight-bearing joints? Number 2, a sudden onset of the disease with redness and swelling of the joints? Number 3, complaints of joint stiffness after periods of activity? Number 4, pain that improves with use of the joint? And the answer here is number 1. In the question, pay attention to what type of arthritis they're talking about, because there are some other types too, rheumatoid and septic. And so what we would expect with osteoarthritis. Osteoarthritis is the cartilage is degenerating, and so that would be gradual. It usually happens to those weight-bearing joints, the knees, the hips. It can also happen with the joints that get overused, like the fingers. There is a genetic component to it. The pain increases with use because the bone on bone, that rubbing really hurts. Though it is painful, the joint actually moves better with use. So the stiffness is in the morning and before they become active. And there can also be nodes present if it's a chronic situation. So that could be another thing that the client might point out, is that they have these nodes on their fingers. So that's why number 1 was right. Number 2, that was describing rheumatoid arthritis. Number 3, that's not right because we said joint stiffness improves with activity, so it gets better. And then number 4, we said that wouldn't be true because pain actually gets worse when they use it. So in the further learning, just make sure that you know the differences between the arthritises, rheumatoid, osteo, and septic, and specifically those nodes that you can see in osteoarthritis are Herbert's nodes, which are those small bony growths distally, kind of on the fingertips. And then the other ones are called Bouchard's. Those nodes are in the middle, so proximal. So sometimes they like to know Bouchard's is proximal, Herbert's is distal, and definitely connect that to osteoarthritis. Question number 2. In preparing a teaching plan for an adult who had an arthroscopy with arthrocentesis, the nurse will include which of the following? Is the answer number 1, check the distal extremity for color, mobility, and sensation? Number 2, client may return to regular activities immediately after procedure? Number 3, remove compression dressing 6 to 8 hours after procedure? Number 4, keep extremity in flexion for 24 hours after procedure? The answer to this question is number 1. In the question, you need to pay attention to whether it's pre-op or post-procedure. So this is post. So I'm thinking everything necessary for an arthroscopy and arthrocentesis. So if you didn't know what that was, these words are Latin, and a lot of times if you can break down the word, it kind of tells you what it is. So arthro sounds like arthritis, and then scope, so a scope of the joints. That's what it means. And the arthrocentesis is removal of some of the fluid too in the joints, to check that. So what am I going to include? And I'm going to include things like site care. I'm going to include monitoring for infection. And I also want to make sure that by going into that joint, it didn't mess with the nerve or the blood flow, and that the distal extremity, like the fingertip, is okay. And so I'd also be checking the neurovascular, color, whether they can move and feel that finger. It's actually looking for compartment syndrome. And then because it can get infected, you want to make sure that you cover that site with a sterile dressing, and you should be doing sterile dressing changes there. And the compression dressing should actually stay on for more like 24 hours. So the answer was number 1. Number 2, we don't want them going right back to activities. I mean, they can start walking, but not regular activities. They have to take it a little easy first, no straining. And so in the further learning, I didn't say much about the arthrocentesis, about the removal of the fluid. That is used more so to diagnose rheumatoid arthritis and septic. If it's osteoarthritis, they're really not going to find anything in that fluid. But if it's rheumatoid arthritis, in that synovial fluid, they'll actually find the RF factor. And if it's rheumatoid or septic, they're going to find white blood cells. And then as well, just as a nurse, it's really more important when you guys are studying that you need to study what is the pre-op nursing considerations and post-op considerations, not get stuck on exactly what is happening during the procedure, because that's really not our job. Question number 3. In preparing a teaching plan focused on treatments for a 40-year-old client newly diagnosed with osteoarthritis, the nurse would include which of the following? Is it number 1, application of hot packs to the affected joints to decrease the swelling? Number 2, client education regarding self-administration of pain medications? Number 3, progressively increasing activity to point of muscle fatigue to build muscle around the degenerative joints? Number 4, prepare the client for a joint replacement within 3 months. And the answer here is number 2. In the question, it says they're newly diagnosed with arthritis, and it's asking for treatments. So the initial thing we should be thinking of is that there's this bone on bone, and it creates a lot of pain. So the focus is really on pain control. And if I think about pain control, I've got to go right for number 2. And so in the further learning, pain control and joint rest is the main focus of early osteoarthritis treatments. Clients can use analgesics. Analgesics is for pain, and that would be like acetaminophen, which is Tylenol, topical and PO salicylates like aspirin, so like your Aspir creams, NSAIDs like ibuprofen, COX-2 inhibitors like Celebrex and Aleve, and opioids. So we're focused more so on trying to start with that, the acetaminophen. And just remember with your Tylenol, they cannot take more than 4,000 milligrams or 4 grams a day, or they risk liver issues. And then if the OA is progressing and the x-rays show narrowing in the joint more and more, the pain gets worse, then maybe they can start talking about other options like a joint replacement, but not right now. Right now we're going to think about pain control. So if number 1 kind of pulled you, the hot packs can help with pain, but if we look at number 1, it says application of hot packs to the joint to decrease swelling. So that makes this answer part false. Never pick an answer that's part false. The hot packs can help with pain, but it doesn't decrease the swelling. In fact, hot packs usually would encourage blood flow to the area and could increase the swelling. So be careful there. Question number 4. A 65-year-old client with osteoarthritis shows joint narrowing or bone on bone in his x-ray. The provider is discussing treatment options with the patient to provide the cushion for the missing cartilage. What treatment options could be suggested to the patient? Select all that apply. Is it number 1, viscous supplementation with hyaluronic acid? Number 2, joint replacement? Number 3, pain control? Number 4, physical therapy? And the answers here are number 1 and 2. The question says which one provides cushion, and the treatments to be suggested, there's only 3 choices that kind of try to put that cushion back there. And it's supplements, the chondroitin glucosamine supplements, viscous supplementation, and joint replacement. So numbers 1 and 2 are correct. If we pay attention to what the question is asking us, we wouldn't be picking numbers 3 and 4. So in the further learning, a little bit more about these treatments that attempt to replace the cartilage. Glucosamine, that supplement, glucosamine is a precursor to build cartilage, whereas the chondroitin part of that supplement stops this enzyme that destroys cartilage. so that's why it's a perfect supplement. It is available over the counter, but it takes a while to work, and the pills are pretty big. They're like horse pills, so you usually don't see very good compliance with that. The viscous supplementation is an intra-articular injection. They inject a lubricant which helps to let the joint have more fluid motion, as well as a shock absorber. But it's 3 injections, 1 week apart. Post-injection, they can ice and rest the knee. And then for at least 48 hours after the injection, they are not supposed to go jogging, do strenuous activity, high-impact sports, or stand for longer than 1 hour at a time. So that would be some things that the nurse should instruct the patient about. A client with osteoarthritis is planning for a total hip arthroplasty. Which of the following statements by the client indicates the client does not understand post-operative positioning? Number 1, I should not bend down to put on my socks or shoes. Number 2, it is okay to cross my legs if I'm sitting in a chair. Number 3, I should put a pillow between my legs when lying on my side. Number 4, I should not sit in low chairs or on toilet seats that are low. And the answer here is number 2. So the question is asking what is wrong about positioning after a total hip arthroplasty, which is just a total hip replacement. And so we should be thinking about post-operative positioning, and then we want to pick something that goes against that. So for post-hip replacement, clients should stay in a neutral position with their legs abducted, so slightly out, with that pillow between their legs. And they should also have these trochanter rolls on the outsides of their hip to prevent their hips from externally rotated. They should really not do any serious bending. No crossing the legs, no bending of the hips, no flexion greater than 90 degrees. And therefore, if we look here, the only statement that is wrong is number 2, and that's what it was asking. Which one indicates he does not understand the positioning? Number 2, he cannot cross his legs. There he says it's okay to cross my legs. So be careful with, where they say which one indicates they understand versus which ones indicate they don't understand. I know I have to take my time and be careful with those. So number 2 is the answer. And further learning, it's a good idea to know all your nursing considerations for joint replacements. This one talks about the hip. We also have the knee. But for the hip, pre-op, it's a good idea that they know how to use their crutches or walker before they go in, so they can practice that. Make sure they know not to take any NSAIDs like ibuprofen or aspirin, or even any blood thinners a week prior. Post-op positioning is very important, as we discussed, because that can lead to a dislocation of the hip prosthesis that they just put in there. They are supposed to get out of bed first day post-op. We need to watch out for clots here, so it is best to get them up out of bed if they're okay. We should be giving them preventive, prophylactic anticoagulation injections like heparin or enoxaparin to prevent clots. We also need to monitor for that hip dislocation. So would you be able to spot that in your patient if that did happen? And the complaint would be increased hip pain, shortening of the affected leg, and a weird kind of external leg rotation would be your hints there. Make sure you call the doctor if you see any of that. That's it for a quick look at osteoarthritis. Hope you feel like you understand the arthritis a little bit better through the lens of being able to critically think through some questions. Please don't forget to like this video, subscribe to our channel, and you can always find us at sciencestrategies.com.